Good afternoon, everyone. Welcome. We are so happy you are here and joining us this afternoon for our third webinar in our series of helping to support in county approval and provider certification. My name is Donna Lynch, and I'm with the Resource Center for Family Focused Practice. My areas of focus are all things peer partner, that's youth advocate and parent partner wraparound. I do have lived experience. Jacob Robert Shaw and I navigated systems together, and I will be your facilitator this afternoon. Thank you again. We'd love to know who is in the room. So we invite you to introduce yourself. Tamara's already put it in the chat for me. Tamara, you are Lightning McQueen this afternoon. Thank you. Your name, your role, your county, and we love our icebreaker today to be what is a low cost, no cost summer activity in your area. We know youth and families are still in summer, gearing up for school to start. And what are some low cost, no cost activities that we could potentially give to our youth and families? And what better way to do it in perfect wraparound fashion, but learn from each other and see what you're doing in your area. We have a great panel for you today. We've got Gavin O'Sullivan and Dre. I'm going to chop your name up again, Dre. Help me. Tell me your last name one more time.
Coppola.
I don't know why I always freeze. I'm like, dang it. They'll be presenting today and letting us know and giving some insight how Placer County is prepping and approaching for their county approval. So really excited. We've also got the incomparable Richard Connect here with us again today. He was here with us yesterday during our provider certification prepping webinar. We'll hear from him, and Manuel Lua will be joining us during our panel Q&A as well to add value to speak about what that partnership looks like between counties and providers. Again, if you're just joining us, please introduce yourself in your chat, name, organization, role, and what is a low cost, no cost summer activity you are basically sharing with your youth and families this summer. With that, I would love to introduce my team at the Resource Center for Family Focused Practice. First off, I'd love to invite in Tamara. Tamara, please come on in and introduce yourself.
Hi, I'm Tamara Trejos with UC Davis, RCFFP. I am a huge wraparound fan, and my connection to wraparound is as a program coordinator for, we've had contract with CDSS, post-adoptions wraparound, Kaiser, and educationally related mental health services with the school districts.
Awesome.
And
Thank you, Tamara.
Do you want me to kick it?
Yes, kick it. Kick it. Yeah.
I'm gonna toss it. How about that? I'll toss it over to Rebecca.
Hi, everyone. Rebecca Cox, also at the Resource Center for Family Focused Practice, wraparound specialist. I've been a wraparound a long time, held a lot of different roles from coming from the provider lens and now just training, coaching full time.
And Rebecca's had a full day, just launched our foundations coaching to Fidelity this morning. Awesome job, Rebecca. I can't wait to hear about that class. And if you haven't checked it out, go on our website at the Resource Center for Family Focused Practice, check out our classes and register. It's an amazing class. With that, I would love to introduce Lizzie. Lizzie, come on in.
Thanks, Donna. I was like deep in the chat looking at all of the amazing people here today. Hello, everybody. My name is Lizzie Dembos. I'm a specialist with the Resource Center for Family Focused Practice, and I have a background in county child welfare, so I feel like I'm amongst a lot of my people today. I'm so happy to be with you. And I also see a good spread of providers, and I always appreciate being in spaces with providers. I loved working with my wraparound teams when I was in child welfare, so I'm so happy to be here and be a support for our time together.
Awesome. Thank you, Lizzie. And we have James Williams. James is our program coordinator and technology extraordinaire. If you have any issues with your technology during our webinar this afternoon, please side quest James. He will be more than happy to support you. I do also want to say that this webinar is being recorded. It will be posted on our website along with any of the resources and PDF versions of our PowerPoints being presented today. So if you are unable for any reason to download any of the documents or resources during our webinar, they will be available on our our website. Our team will send out a marketing email to let you know when that reporting is up and available, and the resources are available as well. Before I kick it over to Danny Gabry over at the California Department of Social Services, the Family Center Practice Unit, I do also want to say that please hold all of your questions until after both the presentations. You can use the raise your hand feature at the bottom of your Zoom toolbar during the Q&A portion, or you are more than welcome to drop any of your questions in the chat. My team will grab them and we will ask them for you during the Q&A. And with that, I would love to invite in Danny Gabry. Danny, good afternoon.
Hi, good afternoon, everybody. I'm Danny Gabry, manager of the Family Center Practice Unit at DSS. Our team is responsible for all things high fidelity wraparound. We're pleased to be with you to join us today, and thank you to all of our partners. UC Davis is such a great partner for us to work with, and I want to thank our presenters, and I'll quickly introduce two members of my team are here today. I think it's important to point out, especially for this group, that we do have county wraparound consultants assigned to every county. Two of our consultants are here on the line today. So Kayla and Chris, why don't you jump in and both introduce yourselves?
Who's first? Go ahead, Chris.
Good afternoon, everyone. Chris Petty, also with DSS Family Center Practice Unit, as Danny mentioned, and been with CDSS for now over 5 years. And yes, I do provide consulting services with several counties in the state. And now I'll kick it over to Kayla.
Thank you, Chris. My name is Kayla Granderson, and I'm with the Family Center Practice Unit. I've been here for almost 4 years. Prior to this, I was a youth advocate, and then also former foster youth. And just want to thank you all for being here today, and I'll pass it back to Danny.
Thanks, Kayla. Thanks, Chris. Donna, do you want me to go into introducing our speakers? Great.
Yes, ma'am. Let's
I
get
will
this
do
going.
our introductions. We're happy to have so many of you with us today, and thank you to our speakers who have donated their time to share their wisdom and expertise with all of you. First, we have Richard Connect, who's managing partner of Integrated Human Services Group, where him and his affiliates provide operations, leadership, strategic planning, and training services to public and private healthcare and human service systems. He's a former chief operating officer of a large behavioral health hospital, former senior vice president of program operations for River Oak Center for Children, and is an advisor to state agencies where he provides guidance and cross-systems technical assistance to multiple departments. Also, very importantly, he's a lead designer on the integrated core practice model, and that now anchors the system of care in all 58 counties in California, as you all know. After Richard, we have Gavin. Gavin has been with Placer County System of Care for 31 years. He's been a wraparound facilitator, a classroom therapist, a group home administrator, a child welfare supervisor, wraparound supervisor, and most importantly, he is Buddy the Elf for all wraparound family events. So everyone give Buddy a hand for joining us today and coming on out before the holidays. He is also joined by Andrea Coppola, she goes by Dre, and she's a senior analyst with Placer County. She comes to Placer County System of Care from CDSS 8 years ago. She's developed data models, written grants, and project managed for several initiatives. Andrea works with Gavin and his wraparound team through the requirements for high fidelity wraparound. She's working on the work plan for them and is running outcome measures for this effort. She's also a part of our work group working on piloting the tools for CQI process for wraparound. So we really appreciate her effort and her role in wraparound. Finally, for the question and answer portion, we will be joined by Manuel Lua. So he'll be able to help answer some of your questions if you have anything coming from that provider perspective. So he's going to join us today from Victor Family Services. He is a marriage and family therapist, first generation Mexican-American and proud son of migrant farm workers. He's chief operating officer at Victor Community Support Services, and he has served in various capacities of management and leadership throughout his years. His specializations are CCR, ICPM, wraparound, 0 to 5, CANS, and CFT. And then outside of work, he likes to coach his kids' baseball team. So we are grateful for him to be here for our Q&A portion at the end. Thanks, everybody.
All right, Danny, thanks. I think we're going to jump right in. Donna, unless you've got anything else for us.
Nope, sir, take it away. And I believe James will queue up your PowerPoint right now as well.
Fantastic. Thanks to Team UCD and our partners at CDSS. And I do see some familiar faces from yesterday, so apologies in advance. You're going to get the same shtick from me today that you got yesterday. So if you were here with us, feel free to take an extra long break and come back in time for Dre and Gavin and what follows. I'm going to spend just a few minutes just setting some context really for implementation of wraparound in a system of care environment. You can go ahead and go to that next slide, James. Thank you. It's super important to understand that the system of care and wraparound go together. System of care is in most jurisdictions outside of California synonymous with wraparound. When they refer a kid to system of care, they're talking about wraparound. When they refer a kid to wraparound, they're talking about system of care. California is unique in its approach to wraparound in that we started it 28 years ago without the infrastructure of system of care. And we got some dividend for it anyway. Most of you have been around a while. You know we've got some significant gains statewide since we started doing wraparound back in 1997. But the reality is the sustainability of wraparound is deeply interdependent on the system factors. And we're going to talk about that a little bit in the next few minutes. There is a deep inherent interdependence that will make your wraparound plan much more effective and sustainable if you will locate it within and around the ecosystem work that your interagency leadership team is doing and that's anchored within your system of care MOU. The bottom line is absent effective interagency integration in key areas, which we'll talk about in a couple of minutes, wraparound is unlikely to be sustainable or to yield the kind of return on investment that we hope that it will continue to do as we move into a high fidelity environment. Next slide. So really important to recognize that there's absolutely no divergence between the system of care vision and its principles, which form it, and the wraparound principles and the vision of wraparound. They are, again, synonymous. So really quick look at the definitions that come out of the literature on both system of care and wraparound. And just take a look at the synchrony and alignment here. Both system of care and wraparound have this fundamental shared goal of helping us and the healing field keep our children and youth safe at home, in school, and out of trouble, right? The essential takeaways of all system of care and all things wraparound are to do those things. So ultimately, again, wraparound system of care fully aligned in terms of their purpose, intentionality, and vision. Next slide. Thanks, James. Real quick look at just the definition of system of care from the literature and research that the late, great Sheila Pyers pioneered across the country for nearly 4 decades. And I want to give you just a moment to reflect on that definition, particularly paying attention to the bolded font there. This, of course, is the purpose of all things system of care. And what I hope resonates for you is that the words you see reflected there are very similar to your wraparound mission statement, your wraparound vision statement, your program statement that informs your wraparound model, or the kind of language that will go into your high fidelity wraparound plan. When you tell the state ultimately what it is you're going to build with high fidelity wraparound, these are the kind of words, right, that will resonate. And there's some complexity to that. And so I always try to add in that the elevator version of what system of care is and what whole child, whole family pursuit means is that it's organizations sharing 4 things: risk, resources, responsibility, and reward. The 4 R's of wraparound, the 4 R's of system of care, if you will. Next slide. So really importantly, the next 2 slides, just want to spend a couple minutes on these. Hopefully in your responsibilities as builders, designers of all things high fidelity wraparound, you're at least aware at this point that in all 58 counties, we have now an expectation that there is an interagency agreement anchored in a memorandum of understanding that suggests that at least 5 partners, and in some counties it's more, will come together to attend to the conditions for successful services for kids, right? So at the far right-hand side of this little graphic, this visual, we want good outcomes for youth and families. And in order to get good outcomes for youth and families, we have to implement programs of all types, not just wraparound, with fidelity, right? And adherence to certain standards. And you now have those wraparound standards. And we've highlighted in that bright red heart-shaped thing there that in this case, in the conversation for today, it's wraparound that you're going to be implementing and pursuing a high fidelity application of that. In order to get there, your interagency leadership team and you as supervisors, managers, analysts, leads in the design work, you got to pay attention to certain things or the model won't work to its full effectiveness. And the things you're going to pay attention to, which are anchored in your system of care memorandum, things like how do we share information on the far left-hand side of this? Look at those hospitable system-wide conditions. Your senior staff and the executive advisory committee or the advisory team or whatever you call that second tier of leadership within your system of care, they're paying attention or should be paying attention, courtesy this MOU and their ongoing process, to things like how do we share information? How do we maximize our fiscal resources, our revenues, both federal, state, and local? How do we cross-train to what will be a wraparound model or an enhancement of our wraparound services, depending upon what county you're in? How do we cross-train? Who gets cross-trained? How do we co-locate when necessary? What's the value of that in our particular community? Do we have an aligned interagency vision? Are our organizational relationships in sync? Are we together? Do we trust each other? Is there coherence in the system? If leaders don't attend to those things, then no evidence-based or evidence-informed practice will be sustainable because there's not enough money to do it, or you won't be able to train consistently, or you won't be able to move information to coordinate care between the agencies that are responsible for the model, in this case, wraparound, right? So I hope it's resonating that unless the system attends to the environment and the functions that the system partners have to do, the implementation of any model, in particular wraparound, won't work. Next slide. To give you a quick look at what's a common emerging structure for this system of care in, again, all 58 counties, anchored by a memorandum, all rooted in Assembly Bill 2083, there is an interagency leadership team. And in many counties, most counties, in fact, there is now some kind of an executive advisory, kind of a second tier. These are senior managers, deputies, associates, superintendents, assistant chiefs, if you will. They come together every month, hypothetically, ideally, right, to attend to all those conditions that we talked about on the prior slide: information sharing, revenue maximization, co-training. And in the course of doing that, they also attend to what are the reform initiatives, what are the opportunities for implementation that will ultimately make the system work. So left to right at the bottom of this graph, at this visual, you see things like high fidelity wraparound, which is the topic for today. And the necessity of connecting what will be required of you locally is to have a community leadership team specific to high fidelity wraparound. And what is their relationship vis-a-vis the system of care leadership team, right? Other things that system of care partners are attending to are things like the comprehensive prevention plan or prevention work in our county. What's the relationship with CalAIM and the availability of enhanced care management community supports? And then another example is community schools implementation, right? We've poured a great deal of resources into the development of high fidelity community schools work around the state, and the system can hold that too. So then these are just 4 examples, wraparound being one of them, of the things that the system can hold as a container for implementation, right? And so that leadership team concerns itself routinely with how are we doing that work. Next slide. So sometimes folks will ask when we implement a program in the system of care, because there are 5, sometimes more partners, some partners will ask, some departments or agencies will say, well, what's in it for us? Like, why are we concerned about this particular model or this particular population of focus? And so we want to spend a moment for you, because hopefully you're going to have conversations with your ILT or your partners at some level around why are we implementing high fidelity wraparound? And the reality is there's something in good wraparound practice for all the partners in the system. Even if your kids, developmental kids, regional center kids, special ed kids, right? Even if they're not in foster care or bumping into the foster care system, they're still our kids. And there's a payout potentially for them in a high fidelity wraparound environment. Some of those payouts involve things like recognizing that youth with developmental needs way more likely to get broader access to the parallel services that they need or to differential assessment and diagnosis if they're in a system of care environment. Young people with chronic absenteeism, students who struggle with issues that get them suspended, they're far more likely to get their needs met and to work towards school graduation in a system of care environment, right? Fewer youth placed out of home via special education status. So some of you may know the statewide data on this. And ever since we identified that we were no longer going to send foster youth out of state for their intensive services needs, so it's been about 4 years, maybe 5 years since we did that, we've seen a steady incline, a trickle upwards in the number of young people who are placed out of state via an IEP. So they're special ed kids. So what that tells us, if you look at the broad ecosystem, is that while we're trying to do the right thing for foster youth by keeping them at home, in our local communities for their intensive services, the system is pressurizing out-of-state placement via special education. We don't want that, right? That puts a burden on schools. So there's a benefit for schools in being in this high fidelity system of care environment because you can address then that systemic problem of how come we keep using special ed as a vehicle to get this kid out of state, right? Which we don't want to see happen. Additionally, you'll see fewer homeless and housing impaired families. You'll see less caregiver strain, all of which means that fewer kids will be cascading into complexity, if you will. And again, all from a system of care environment. And we're going to look at the research here in just a minute or two. Next slide, James. Thank you. So I mentioned the hospitable conditions for change. The fidelity standards for wraparound coincide with, not by coincidence, but by design, with some of the elements of the System of Care Memorandum of Understanding. Within that System of Care MOU, the leadership team has to attend to 8, 9, 10 key functions, right? And among them are things like, what's the leadership team? Underneath the high fidelity wraparound standard, you also get to convene a community leadership team. What's the relationship between these two leadership bodies? Are they rowing in the same direction? Is there support from the ILT at the most senior level for the wraparound community leadership team? Is there a reporting mechanism, right? Are we working together? The second area involves fiscal and funding. You all know wraparound's way too expensive a service for one agency or one department or one system to fund on itself. It's never been sustainable when it's done in a high fidelity environment. And so the demand opportunity invitation for the ILT is to figure out how do we revenue share. And in the high fidelity standards, there are expectations that you'll figure that out. It's gonna invite us to a local conversation about blending and braiding money in ways that you haven't had to do, at least in many counties. Third area is workforce development and training, right? Like how do we train? How do we recruit the right people to do wraparound? How do we coach them in a synchronistic way so that folks from the behavioral health arena that are on a WRAP team have the same vision for what wraparound means as the folks who are case carrying social workers or probation officers? When foster youth support professionals from schools step into a wraparound team, or when a teacher steps into a wraparound team, like, do they understand the high fidelity model in our county, right? So cross training to everybody in the system so they get what it is we're trying to do with high fidelity wraparound, super important. Fourth area, finally, is the quality improvement. While there is no specific demand under the 2083 practices for the system of care practices for this, there is an obligation to share data, right? And the data, of course, informs our continuous quality oversight and compliance, which is a high fidelity standard. So we're going to review some of these in detail here going forward. But I just wanted, this is a summary of the 4 critical interdependencies between your high fidelity success and the system of care, which underscores and supports it. Next slide. So here's a quick look at some of the detail within this. And the first of these 4 standards, again, sets of standards, is the community leadership team. So this is language taken from the BHIN, ACIN 2547, I think is the right number, although I'm numerically impaired. I think that's the right one. And we've highlighted a couple of elements of that. So in bold red font here, you'll see the expectation that we actively identify and remove interagency and system barriers that interfere with interagency collaboration, effective service delivery to families. Here's the little secret. Your community leadership team alone probably isn't powerful enough to do that. They can try, but unless they're composed of the right people and they have connectivity to department heads, agency chiefs, superintendents of schools, right? If they don't have access to a higher order of authority and responsibility within the system, they're not going to be able to remove the barriers, right? Second standard here that's interesting and connects to the system is identifying and supporting cross-agency training and community collaboration to promote family-centered and culturally relevant practices to get to fidelity, right? So two of many areas where you're going to need to figure out how the community leadership team relates to the interagency leadership team or to that executive advisory committee within the system of care. Next slide. The second area is the fiscal and funding. And again, we've lifted some of the standard language here. Notice in red font that the standards are going to require that you share resources in ways that allow us to make resources available across the system of care. That's language from the all county notice, right? So that's not just system of care people talking here. That's the state expecting us to use the system of care to leverage to the maximum extent possible to meet the needs of family and youth. Collaboration, equitable contribution across system partners are principles of high fidelity wraparound. What this means is we're not going to look to behavioral health and say, you all get to fund this wraparound thing because after all, you got Medicaid monies now that are available to you that you didn't have before for wraparound. Like that's not how it works. If we're really going to sustain wraparound in our 58 counties, we've got to figure out how do we truly put our money on the table and our hands behind our back. And that's your interagency leadership team that's going to have to help you do that. You're going to have to convene fiscal managers, budget analysts, budget officers from your various departments in a conversation to design a funding stream that's sustainable and committed to over multiple years, right? So that we don't fall prey to that far too often habit of funding things that look pretty in the moment, but as soon as there's a budget crisis, we abandon the program. Won't work if we do that. Have included a little link here that you'll be able to look at. This is this link here that's hyperlinked, that will be hyperlinked in your PDF when you get this, is to about a 5-year-old matrix of funding streams that are available to fund wraparound. It'll need to be updated the next few months, and I'm sure we'll get to work on that with the state. But as we move into the next slide in just a second, we're going to explore the reality that it's not just Medicaid and 4E money and not just Medicaid 4E and realignment that fund wraparound. There's actually multiple ways to blend and braid numerous resources to sustain your high fidelity model going forward. And let's take a look at that. You can go ahead and advance us, James. Thanks. So here's if you're a visual processor, and this is what's amazing about this moment in California's history. On the far right-hand side, in the blue bubble, we have this visionary idea that we're finally going to get to one child, one family, with one team, with one assessment and communiometric device, the CANs, in order to get to one plan, right? We have never been this close in California to actual authentic one child, one plan work, but we're on the cusp of that. And that's what's remarkable. That one plan, one child doesn't mean you have one funding source that holds all the burden. In fact, here's the beauty of being in California. We got a rich environment of financing resources that can fund one plan. And on the left-hand side of this, it's multicolored portion of it, you'll see we got access to Medi-Cal, and there are actually multiple ways to access Medi-Cal dollars, right? It's not just EPSDT anymore. You're going to get a bundled rate from the Department of Healthcare Services that allows you to have a baseline for Medicaid-funded, Medi-Cal-funded wraparound, upon which you can layer in then specialty mental health services. In addition to Behavioral Health Services Act, state mental health monies, we've had these in full service partnership, doing some forms of wraparound, if you will. That's going to be part of your wraparound plan. And as we learned yesterday and had highlighted, the expectations on the county mental health plan are that you won't be able to fund full service partnership wraparound unless it meets some standards as well, right? So the state's figuring out this necessity for synchrony between the high fidelity wraparound approaches that are funded, regardless of what the funding stream is. Like, we want to do high fidelity wrap, right? In addition to those two funding streams, we've got numerous dollars that come to you courtesy state social services. So things like the family urgent response money, intensive services money, and that's not a full list. There are others, right? So getting your budget analyst to help you identify, where do we support intensive services for kids in our county? If it's an intensive service, if it's serving a kid with complex needs, chances are it belongs in that metrics, that set of metrics that will fund wraparound going forward. Obviously, there's realignment money, hopefully left in your county if it hasn't been fully swept up by the departments. And then, of course, we don't talk about this often, but in the educational mental health arena, there are dollars that in many local education areas or at the county office, they have access to services for what they would characterize typically, it's a generalization, but typically it's kind of like a tier 3 service, right? So kids, students on campuses who need intensive mental health services, there's nothing forbids you in a county system of care, if it's well functioning, for identifying how do we leverage those dollars into our wraparound funding model. Again, numerous funding streams, one plan. Don't let the funding streams distract you from the reality that you're going to have a uniform, singular, whole child wraparound plan. That's the big takeaway. Next slide. All right, third area is training, recruitment and training, right? So it's critical that we understand programs have a high fidelity training plan expectation that incorporates initial annual booster training. So it's not a one and done. There's got to be a coaching model here. If you're wrap savvy, you know wraparound, because of its intensity, can drift very quickly. You'll get programmatic drift if we fall asleep at the wheel as managers and leaders of wraparound programs. So we got to coach to this. That plan has to include both general high fidelity wraparound training and role specific training based upon the functionality of the person assigned within the team, right? So there's going to be a fair amount of specificity here. That's all part of the fidelity model, right? It's so we don't lose the focus of what each person on the team does in a high fidelity environment. Also want to call out that the training plan has to include ICWA, tribal sovereignty training, right? Because it's just a critical connection piece. Next slide. All right, fourth and final area for the detail, and we've lifted some of the standard language here. And just notice, we won't spend any significant time on here, the detail, but notice some of the standards here that there's an expectation that we attend in a quality management oversight. We're looking at data that tells us, is our school functioning improved? Is our community functioning improved? Is our interpersonal functioning improved? Do our caregivers have more confidence? Let's go to the next slide really quickly. There's 3 or 4 more there. Is the restrictive environment, is the living environment less restrictive than it was before wraparound, right? Are we experiencing a reduction in inpatient? I love this. The Department of Healthcare Services has an expectation that when high fidelity is up and running, we are going to see fewer kids in inpatient hospitals, right? Fewer kids sitting in emergency rooms waiting for placement, right? These are the kind of systemic outcomes, we're going to look at a slide here in just a second, that you get from system of care alone, right? So when you couple high fidelity wraparound in a system of care environment, we're going to amplify these outcomes in significant ways. It's an amazing opportunity here in California. We're also going to get a reduction in crisis visits. So you'll spend less time responding to kids in flight mode, right? Or kids in fight mode. We'll be dealing with and addressing their trauma-related behaviors in way more effective manners, which comes with wraparound, right? All right, next slide. Highlighting all this, this is a quick look at some of the research that comes to us courtesy the National System of Care Outcomes work. So again, I mentioned earlier Sheila Pyers and the work that she and her partners have done. This comes out of the University of South Florida, the University of Connecticut most recently, but also Georgetown University historically, where they have studied wraparound systems, including some systems here in California. Placer, you're going to hear from them in just a second, okay? SAMHSA folks were here studying Placer way back in 2006. System of care work, right? These outcomes that you're looking at here, these come to us courtesy system of care. So again, remember, system of care and wraparound go together. So we're going to see these outcomes that come simply from higher levels of integration, right? Not necessarily wraparound. So by being in the sandbox together, sharing people, sharing resources, sharing information, we get the kind of outcomes that we need. Next slide. Finally, in addition to all those things, there are systemic benefits from wraparound, including sustainability. So we won't be in that kind of treadmill of funding. We're going to have a sustainable environment. We're going to get an expansion of the flexibility of our resources. So while 4E and Medi-Cal are usually the go-to baseline resources, we're going to be able to fully draw down those because they each require a match, right? So in most cases, they're somewhere around 50 cents on the dollar. We're going to be able to match them in ways that let us pull more money out of Washington, courtesy California's rich funding environment. So there are lots of benefits to doing wraparound in addition to the programmatic research. Next slide. Finally, I want to spend a moment just identifying the integrated core practice model forms a basis now for all things children and families in California. The 12 principles of the integrated core practice model are synonymous with the principles of wraparound, a couple extra based on research that comes out of SAMHSA, again, for system of care. There's a couple slight differences in the model, typically 4 phases in a wraparound model. We got 5 phases in ICPM in California. It's just a breakdown of engagement and assessment. It's the only difference. Here's the most important takeaway. The professionals who are going to sit on your wraparound team, if they're trained and oriented ICPM, are far more ready to be WRAP team members. So again, your foster youth support professionals, your public health nurses, your teachers, your SELPA administrators, special education folks, your community schools, liaisons, all of those folks who are going to sit on wraparound teams, if they're oriented to ICPM and they understand the frame of core practice model-based work, they're going to be much more fully aligned, and you'll have fewer road bumps, fewer hiccups in getting them aligned to your wraparound work. Next slide, James. All right, a couple slides here, just lifting language from a couple of system of care MOUs. So 2 or 3 counties have a little bit ahead of the curve in terms of connecting wraparound into the system of care work. This language, this is quotation from Tuolumne's system of care MOU, right? And so calling your attention here at the bottom to these 2 elements where Tuolumne's made a commitment to work with community agencies to ensure collaborative and integrated strategies are utilized and to promote and utilize strength-based, family-focused practice on a systems-wide basis. That sounds to me like wraparound. And in fact, they concretize that by saying in the very next bullet of their memorandum of understanding for 2083, they say, we're going to coordinate and monitor the delivery of high-fidelity wraparound and enhanced care management, that whole CalAIM thing, as part of our capacity building and alignment of care objectives. So very progressive MOU work. Tuolumne saying, look, we see high fidelity coming. We're going to make sure it's part of our system of care. We see enhanced care management coming under CalAIM. We're going to make sure it's part of our system of care. I hope this is resonating. One more example comes to us from Santa Clara. Next slide. Thanks, James. Just quickly calling your attention to this is, again, quotation from Santa Clara's Memorandum of Understanding. Their operations manual within their system of care says these youth may receive or need intensive therapeutic services such as wraparound, specialized therapeutic homes, STRTP therapeutic programs, therapeutic foster care, et cetera. So again, another example of where the system of care MOU holds and sustains the commitment to high fidelity wraparound within the system of care environment. Next slide. Finally, recommendations. So some of these I've hit on already, but just to summarize really quickly before I kick it back to folks who are going to tell you about local work in Placer. These are recommendations for you to think about, and you'll hear Placer reflect on these probably on some level, at least many of them. We would like to encourage you to orient and align the interagency leadership team to your work. So present an overview of the plan requirements and get their support for your one wraparound plan, right? So go to your leadership body, interagency, and say, this is what we envision for wraparound. We'd like for you to consider identifying when you do your community leadership team, identifying an interagency development team, convene and facilitate the program and fiscal folks together to ensure that the Medicaid wraparound documentation building practices and that the full service partnership resources are aligned and understood. Make sure everybody understands the standards and expectations, right? Because you don't want to get too far into the planning process and get surprised by a standard that you didn't realize, because you'll have to backtrack, right? Third element is engage your wraparound and other intensive service providers. Make sure they give you early input. Make sure they're involved in the planning process. Make sure they're fully aware. Fourth element would be when you get to designing and implement and inviting your community leadership team, make sure that, again, they are connected to your system of care MOU using language similar to what Tuolumne did or to what Santa Clara has done. Just pulling that community leadership team within the system of care architecture will pay dividends going forward. Remember that your managed care plans are doing enhanced care management and offer other services that could be parallel to your wraparound plan. So it may not be a formal part of your wraparound plan because ECM is not wraparound. It's much more akin to like turbo case management, right? But there are kids who can be served by that part of the system that can avoid then access or need for a high fidelity wraparound service. So connecting and coordinating with the enhanced care management networks in your county is going to be super important. Number 6, when you finally get to drafting the plan, remember to continually agendize the status of the plan with your executive body. So go to that group routinely on a quarterly basis, semi-annually at least. And importantly, if I were in county land, I would ask my ILT members to all sign my wraparound plan. It only has to be signed by probation chief, the welfare lead, and the behavioral health lead. But I would go to all the members of my ILT and say, hey, this is our WRAP plan. Would you all like to sign this for us? Number 7, when you do submit the plan to the state, there's a WRAP certification portal. It's got loads of resources in there. You're going to hear more about that if you haven't already from our friends at UC Davis. And then finally, once your plan's accepted and you're up and running, on a semi-annual basis at least, I would go back to the ILT and I would say, these are our outcomes. This is what the data is saying about our effectiveness. This is where we need improvement. These are the things we need you to help us with. Help us remove the obstacles, right? We got problems. It's not working that well in this area. Help us figure it out, right? So use the expertise, wisdom, power, authority of that interagency leadership team to get your wraparound plan done. And I think that's it. I've gone way over time. Next slide, James. Let me make sure I didn't leave anything off. Yeah, good to go. And look forward to your questions. And I'm going to yield, I think, to Dre and Gavin.
Thank you, Richard. Awesome. And we have pulled all of your questions from the chat. We'll answer it during our Q&A portion. And with that, I would love to pass it over to both Gavin O'Sullivan and Dre Kupala from Placer County to give us their expertise in prepping for county approval. Thank you, both Dre and Gavin.
Great. Thank you so much, Donna. Thank you, Richard. If everybody could do us just a super quick favor. If you're near your computer, could you go down to the bottom bar, hit the reactions, and just throw up some appreciation for Richard and the work. He is a collaboration champion, and I just want to give us a chance to just kind of pause, break, and recognize the work that's been going on.
I love that, Gavin. I love that you did that.
Okay, yeah.
In total wraparound form. Perfect.
Well, it's this is such a great community to be a part of, and I'm thrilled to be able to share what Placer has going on. And so I just welcome everybody into this conversation and this unique time, right? We're everyone is forging off in this next year, thinking about what is going to be happening in your area as far as wraparound goes. So I hope that we can impart what Placer has been scratching our heads on and kind of fathoming to this point. Let me get my my slide deck ready. It's going to take me just a quick second. And here. All right, let's see. Is everybody able to see? Is that coming through okay? Great, thanks. Nice. All right, so please let me introduce my co-presenter, Dre Kupala. Dre, do you want to kick us off with our first few slides and say any words?
Okay, so Placer County, we're with the children's system of care. Our other portion of the system of care is the adult system of care. So, but we're representing children's system of care today. And next one. I'll just show you where Placer is, just in case anyone's curious, and I love maps. So we are nestled between Nevada County, El Dorado County. We've got what the piece on the left is we call that our South County, where Roseville is, if you're familiar with Roseville. And that's the majority of our population is in South County, because then you follow I-80, if you're familiar with Interstate 80, it goes up to Lake Tahoe, kind of on the North Shore, they're Truckee and Lake Tahoe. So I-80 goes up through the foothills and up into the Sierra Nevada. So most of our population, again, is down in that South County before you get up into the foothills and into the mountains in Tahoe. So that's where we are. And then just some quick stats, you know, the population, under 500,000, and again, the majority are down in that South County. We have very few really relative to the state of California living in poverty. California is probably about 12%, and Placer County is, you know, almost half of that. And it is a predominantly white county. It's, you know, we do have a Hispanic Latino population, and then another language that has come up now for us is Russian. So we have Spanish and Russian and English are our predominant languages in the county. And then this is just a quick view of how our systems, plural, so we have adult system of care and children's system of care, how our systems of care work with crisis services, substance use services, court-related nursing, education, housing, probation, in-home supportive services, you know, MHSA, BHSA, outpatient treatment, you know, a wide variety of resources, community partners who we sit side by side with and work with day to day. And it works very, very well. So a lot of fantastic communication and collaboration and a lot of different perspectives all the time. So that's an intro to us. And now Gavin gets to jump into wraparound and how we've been getting into this high fidelity wraparound model.
Thank you, Dre. So let's all just kind of even appreciate the collaboration that's happening, the integratedness that's happening here. So it's not by accident that we're teaming up as a clinician practitioner. That's kind of me, and our analyst, our data extraordinaire, and that's kind of a superpower. So I want to plant a seed for counties thinking about who you're pulling in as your partners, who are going to be helping you with this process. So we would not want to do this without Dre and her team. And really setting the stage with that prior slide is Placer County has been a system of care for as long as I've been here. And it's a little bit like, you know, in my the first box on the slide there, we've been doing wraparound for over 25 years. I'm reminded of that image of two fish swimming along, just enjoying their outing, and another fish swims by and says that kind of classic question, how's the water? And the other two fish say, what's water? And that's for me, and probably some that's like, what's life without wraparound? What is life outside of it? What do you mean integration? That's all I know. What do you mean wraparound? That's all. It's what we eat, breathe, and sleep. So that's a part of our setting the stage in Placer, is that this kind of, in a way, is all we know. So it's an interesting exercise to go through this application process, because it's like, okay, we're going to explain everything that we do. There are some things that are opportunities to bump up and notch up, and we're looking forward to that and trying to recognize that. But just letting you know where we're coming from in Placer. All right, so our WRAP program is in-house county employees for the long-standing time. 2 years ago, we started our first contracted partnership with a wraparound provider. So by and large, our real kind of institutional memory here is doing it in-house, doing it ourselves. And we continue to do that, like I said, along with that private contracted partnership. We have in our in-house team, we have embedded youth and parent peer support specialists. That's been for a couple decades. It's an amazing resource to have as a part of our wraparound team. We can serve up to 90 families together with both providers. We use in Placer, just so you know, kind of again orienting who's talking to you. We're coming from a mindset where for years we've really just been using Medi-Cal reimbursable dollars through specialty mental health, and also MHSA, which is turning into BHSA. So that's really been our makes up most of our funding, and allows us to be able to do a lot of preventative work. So we are able to serve families that are experiencing CSEC risk factors, a high volume of either 5150s or mobile crisis contacts, court involved. Of course, we serve our court, but those first two are examples that they don't have to be court involved in Placer to be able to receive wraparound. So we also have our court involved, and of course, within that court involved is presumptive transfers, and that's kind of a, that's its own, kind of conversation with how counties are trying to address presumptive transfers. We've been able to do that with wraparound. And of course, we also have AAP families come, and we don't actually use AAP funds we use, like I said, our Medi-Cal and BHSA, but there are also some AAP wraparound providers in Placer County outside of what I have spoke of. And so sometimes we know about those families utilizing those providers, sometimes we don't. All right. So let's just talk about a couple caveats as we as Placer is approaching our approval. We've been a system of care for decades. So for us, this might feel like we have a lot of things to draw from. And it's kind of like just grabbing that stuff off the shelf and just trying to figure out how to define it and identify it for the portal. But so I'm sensitive that there are some counties here that are, really starting from a different place. And so I recognize that. Just recognize that for us, this is our starting place. Like I said, we're in-house wrap provider. We don't use realignment for the most part. That does happen. Let me break for a moment to say that as an integrated county, we have a director. Our director, Twyla, is over behavioral health and child welfare. So there's seamless ability for the teaming and for drawing of resources, and we have a interagency leadership team, and the probation chief and the chief, the judge over the juvenile courts is on that ILT. So the superintendent of our Office of Ed, all that stuff, that there's such close working partnerships happening there. So when I say we don't use realignment, well, our agency of course uses it, but we don't use that primarily to fund RAP. So if you do, I don't know, we don't have that going on as much. Also, we are planning on submitting one application into the portal for both being a county that is approved to approve RAP happening in their area. We're also submitting that one application as for our in-house wraparound provider. So a couple questions that might come up for you at this point in kind of caveats for you is, what level of ICPM and system of care integration does your county have? Are you talking about ICPM? We've been doing ICPM since the state sponsored that launch. I want to say it feels like almost 8 years ago or so. And it's been really important, even with Placer being a system of care. ICPM is that it's a language and it's a nice structure that is very user-friendly for all of the different disciplines that come together under a system of care to be able to use. So if you don't have that going on, that is something to note for yourself. That's an edge that could help you along with getting ready for wraparound. Also, what is your access to seasoned longtime wraparound champions? All right, I'm going to come back to that, but if you don't have easy access to that, that's going to be important to think about. Who are your fiscal partners? Who do you need to bring in for those conversations? Like I talked about our funding. So be noting that. And yeah, so let's go to the next slide.
Okay, tell him, huh? Yeah.
All right. I'd like to break for a moment to also recognize that there might be some tension. A lot of us here today may be feeling like we can roll our sleeves up for this. We can do this. We understand enough about wraparound. But I want to appreciate that there are a lot of counties that may not have active wraparound going on. And so there may be even a sense of hardly ever having, if at all, placing youth in an STRTP. There are some of our other county partners out there that have a population and they're able to maybe figure out some awesome intensive foster care stuff. And so FFPSA step down isn't applying to you immediately. Hold that thought, all right? But I want to recognize that may be a starting thought for some. Other counties that may have contract providers are also thinking, hey, how can I possibly get through the portal? And this was addressed in last week's webinars, but is there not a place for us to just say, well, we're going to meet this standard by requiring the providers that we do contracts with to meet that standard? That's how we're going to meet the standard, is our providers are going to meet it because they're going to be certified, and kind of a circular, idea there. But for both of those ideas, what I want to say is that this is about solidifying a way forward in serving the families that need the resources the most. And it is going to have carryover effects for every part of the way that your county probably does business, if it's not already doing it. So for Placer, we've been doing this, but still it's a good reach for us. We're going to bump things up, but this is an opportunity to support families at the next level for your county. So that's what I want to say is a huge piece. And Richard really spoke to the outcomes that happen when a system of care is going on. So if you are at that place of being like, Gavin, Dre, great, Placer's doing it this way, how can we find a happy medium? How could we find that middle path of, we can't go complete overboard, but okay, we're not going to do nothing. So I want to give you an idea of something that can carry you through. And I want to use the wraparound planning process to inspire you. So I'd like to suggest that as you get ready to submit for the portal, we're doing this in our own little version, is to use the 4 phases of the wraparound planning process for yourself. Think about, if you have not gone on the portal yet, and there's probably a county in California where no representative may have actually gone through the portal and looked at all of the standards. But if you have not done that yet, you need to engage in a process of getting ready to do that. So we're going to talk today through kind of an engagement lens, but there's plan development and there's implementation, and then there's transition when you submit and you're done, yay. But that's the format that I want to use here. And we're briefly going to use the 10 principles because they will carry you through. So if you are kind of having to loan this, you're having to think about all the different levels of leadership that you're going to be engaging with, the 10 principles will carry you through. So would you allow me to use the wrap planning process on ourselves right now? Are people up for that? Is this okay? Are we ready to do this? We're not going to have a full family team meeting, and I'm not going to carry everybody's strengths. But if you want to put your strengths in the chat, you go for it. All right, now I'm really going wrap. All right, hang on here. So the first thing we're looking at team-based and collaboration principles here. You need to engage a team. So I want to ask you, which agency child welfare services, probation, behavioral health, which one is poised to facilitate this process, to kind of take the lead? You probably have an idea, but somebody is actually going to have to probably be a main point person. I'm just imagining, unless you have some mind meld going on. So that is going to have to be figured out. And in Placer, as I said, there is seamless agreement and cooperation going on with those three agencies, which is amazing and helpful. If you don't have that, if your area is more siloed, then this is going to take some work for you to start engaging those parties now and talking it up. I want to ask then also, who is good at organizing work plans and organizing source material? For us, I'm leaning on our relationship with our analyst team. Dre is so helpful with that. We'll be speaking to that in a little bit, but you're gonna want that for this, because there's a lot of different parts to the standards. So let's see. I want to break for a moment to just also recognize that as we venture on this, we actually did this 15 years ago. And my close colleague and manager, Leslie, reminded me of this today. And it just brought me back. 15 years ago, as Placer wanted to compel itself to be doing high fidelity wraparound, created its own manual. And we've been operating off of that all these years. When that effort actually took place, it honestly mimicked the activity that we're all taking part in right now and about to set off on for this submission. 15 years ago, leadership from probation, child welfare, behavioral health, our peer support specialists sat in a room and broke out different parts of the manual that they would be in charge of creating. They broke off to their little subcommittee, groups. They built their pieces of the manual over a year's time, and then came back together and cross-checked it with each other, and then sought mutual agreement, and then that set off our RAP manual. Literally, that it is something to admire. So anyway, that may be a little bit of a mind picture of how some counties might be deciding, gosh, we actually need to figure out, are we going to be in a virtual room? Are we going to be in a physical room? How are we going to break up all these standards and each kind of take a piece on this? So just wanted to share that. All right. Who else do you have? You have your interagency leadership team. If you are not sure who your interagency leadership team is, this is the time to engage them and to start talking it up. Literally right now is the time to do this. If you do not know who that is, who those parties are, start getting familiar. You also have, on your team is your peer support specialists. Have them by your side. They are going to be the beautiful checks and balances to making sure that this is a comprehensive and holistic submission. You also have your UC Davis is on your team. Think about your different community partners. For us, we have also our cultural partners. We have our Latino Leadership Council, our Sierra Native Alliance. These are important people for you to start engaging in the process right now, to just even let them know, hey, this is happening, this is going on, because you will be wanting their participation as things move. Then information sharing. This is just obviously a technical note, but you do need to think about where are you going to share all this information as you are creating your work plan. All right. So let me just cruise through a couple more of the WRAP principles as you think about. For family voice and choice, again, lean into your peer support specialists. Think about, maybe there are members on your team that have lived experience. Maybe there's adoptive parents, foster parents, others that have used county services in their own personal life, and they may be on the team as a social worker, as a manager, but think about where you can seek out those with lived experience to be a part of this. So engage that. Again, your natural supports. I kind of count UC Davis as our natural supports. I hope that's okay, UC Davis, to think like you're in our family. You're right there. You're an email
100%, Gavin. We are here to support our community in any way possible. That resource document has all the ways that we are supporting. So yes, keep plugging us and CDSS along with support.
I was going to say
Fabulous.
Chris too. You know, Chris is always there for us.
Exactly. So think about any org or other agency providers that you have long-standing relationships with. If you personally don't know wraparound backwards and forwards, if you have a provider that has been providing wrap in your county, this is a relationship that you want to leverage. And this is what I would do if I was in a county that didn't have an in-house model and I was doing this. I would absolutely be leveraging that. So that's a natural support relationship for you. When you think about community-based, you may also want to engage your provider that does CASA or other mentoring agencies in your area, your schools and county office of ed and your family resource center. These are people that you may want to just start engaging in the process of alerting, hey, we're going to be doing a one wrap plan for this county. When you think about culturally competent, don't miss out on connecting with your partners in that area. This is the time to engage and open up dialogue with what stronger ties with them as partners would look like. I want to just hit on individualized. Is there room to build a vision statement for this next year? So I want to suggest, I hope you're not doing this alone. I hope that I'm not speaking to a county that has one representative here and you're thinking, Gavin, Dre, everyone, you don't know it, but I'm going to be leading this entire submission almost by myself. I don't want that to be the case. I want you to think about a vision statement that you can build, just like we ask our family teams to build vision statements. I want you to think about building a vision statement for yourself. Maybe it's a bridge to the ILT or the community leadership team's mission statement or vision. But I want you to think, and if you don't have a community leadership team, your vision statement might actually be the seeds that plants for that community leadership team, because what you're doing this next year is incredibly important. When we think about strengths-based, think about the Assembly Bill, the 2083 MOU that Richard discussed. This is, that should hopefully be some strength that you have going on in your county. Where is that seated? Is, who is leading that? That is whatever group is invested in that system of care MOU, you're going to want to draw from that group. So that's going to strengths based. That's a strength that you have. And also I want to stop for a moment and think Dre, you had a great idea, and we may not employ this ourselves, but think about funding. How much a strength could be looking for some possible funding. And Dre, could you explain, thinking about evidence-based practices, how this could feed into that?
Well, we were exploring it in the way that we're a pilot county for building Fidelity. And when I was talking in a training with UC Davis, they mentioned that we can use FFPS funding for building evidence-based practices. And so as part of our wraparound pilot, we can actually use FFPS funding, the state block grant funds. So we've been considering, do we want to do that or do we hold off a little bit? So there are some decisions, but it's just one more example of just how to kind of think about this from a different perspective. And I'm interested in the first question that came up earlier too.
Great. So we may or may not be using that funding, but it's a question to ask yourself is, do you have some special funding that maybe you can earmark for the efforts that will be happening with this? And then I just want to say, what does your county excel in? Like Placer, okay, I think we excel in being integrated. I think we excel in some of our community partnerships, but I've seen examples that other counties just blow doors off of some aspects that I'm just so excited to see. So know your strengths. Think about your strengths as you engage in this process. because that could be something that you really help hang a lot of kind of energy and derive some motivation from that strength that your county has going on. And also then ask who's also done a similar work of submitting something. If you've never submitted something this big, ask around who has submitted something like this. And so that can help you in your own strengths journey. I'm just going to cruise through persistence. Find a cheerleader for this process. Find someone that can do some celebrations. Find some benchmarks. Just like we ask family teams to celebrate success, find a way to get through this with help your persistence with some cheerleading. So find that natural cheerleader, who that is. I will be available for you as Buddy the Elf to cheer you across whatever finish line that you have. Outcome-based, of course, we're thinking about all our data, inviting your data experts, and then build a work plan. We're going to show you a snippet of our work plan at the end of our presentation, but you're going to need to build a work plan. You're going to have dates, break it up into chunks. All right. And I really feel like I cruised through most of this just now. So thanks for hanging with me in using the 10 principles to help guide you through your submission process. We're gonna get kind of break and go into some different headspace now. So if you're all ready, we're gonna jump into a couple standards. So is everyone good for that? We ready to go get into kind of some of the meat? Okay, so this is directly from the portal. I also really like, and I have not been following the chat, gang, so I'm sure that somebody from UC Davis has already posted it, but I saw yesterday, it was such a helpful link, and I'm wondering if I can slide this over. If I put this in this slide, do you see this web page?
Yes, and we've been dropping it in the chat as well, Gavin.
Drop it. Yes, it is in there. So you all have seen this. This is so cool. Dre actually, a couple months ago, when the portal was in its draft stage, she did her own version of this, and it was so helpful. But now this is the official. So check it out. So we're going to climb through a couple of these, and hang on now.
I love that you said a fish.
Thank you. I know. I try to
I'm all about it.
beautify everything. Yep. All right. Okay. So here we are. This is the very first thing you're going to see in the portal after, welcome to your next year. Timely engagement and planning. All right, let's go to the bottom half. Procedures ensure. So, first contact with families is made as soon as possible, no later than 10 calendar days. So, what can you do as a county? So, we're kind of asking ourselves, what can we do for our provider that we have here? How can we be helpful? How are we helpful to our in-house team? So we are going to share, we're going to cite how we do a really good job of educating our referral sources about what wraparound actually is. Because we all know, and this comes up in the next couple ideas of things, of ways we're going to help, like vetting referral, but we all know that judge or that officer or the social worker that says, yeah, I talked to the family about RAP and they want RAP. But when we talked to the family, they had absolutely no idea what the individual or the court was telling them that they needed to participate in. So we can do, as counties, we can do, and as an integrated system of care county, we can do really good work helping our referring sources really understand what wraparound is. So when they're talking, when they're having those very first touch conversations with families, they're really doing a great job of explaining about what wraparound is. And sometimes it's confusing and hard to do. So this takes some work. Also, the providing vetting process for referrals. So you get the referral as the county. What are you doing to review it to make sure that this thing is actually has legs and can walk? Because as a provider, don't we all know the reach out to the family where if it wasn't vetted, if they aren't truly interested in wraparound, or they have some serious hesitations, or maybe they're leaving the area for a while, or whatever's happening, you're not going to get that thing opened up in 10 days. And so doing that work as a county to have some kind of a vetting process that makes these really, hit the ground running. And then I just want to say that as time goes on, one of the things we're going to do as a county is say, we're going to evolve our referral process with our provider. So we're going to be having some relationship and connection with our provider to say, how's this referral process going? It's going to be dynamic. And then we're going to monitor and do feedback loops with our DART. So if you're not familiar with the DART, many of you are. It stands for the Document Assessment Review Tool, and it is been popularized through the Washington University and the RapStat. So many of you know that. So we've been using RapStat. We'll get into that in a little bit, but that's also a part of us as a county, is we're going to ensure that 10 days is happening to the highest degree possible, because we're going to use a tool like the DART to look at that. All right. The next few just say, yeah, feedback loops with the DART, all of these timing things, that's going to happen with the DART. Interesting. On D, check out D. A lot of us see duplicative cans happening. Like there's a child can have like 3 cans happen from different entities. Also, the CFT FTM process can be over duplicative. There are, in Placer County, we happen to just call them this. You may not call them that, but we kind of call them probation driven or child welfare driven CFTs. These are the ones that happen every 6 months prior to a court date. It's where the cans is updated for them. Well, if that's a WRAP family, they already have regular family team meetings happening, and we call them FTMs here in Placer. So forgive me. I know we're going to find a way to talk about this in the future that everyone understands, but we call them FTMs. Those are already happening. So as a county, we are going to try to take care to make sure that families are not having unnecessary duplication of these CFTs, and also that our WRAP provider isn't spending extra effort that they don't need to help streamline that. And so that the families they're serving are not being pulled into these different meetings unnecessarily. So that's another thing that we can do as a county. E is our analyst team. We've got this work plan that we're going to get into in a little bit more involved. And then F, staff are trained to timely engagement strategies that include encouraging alternate strategies when contact with a family is difficult. That just is sometimes is just like getting as many brains around the table as possible to just brainstorm, what can we do? Can we show up with some food? Can we do this? Can we do that? It also helps to have high involvement from the referral source. That referral source is the one that kind of got this whole thing started. Can they come with positive ideas? We can help with that. As the county, we can not just encourage, but we can essentially get that cooperation, that agreement with agencies for those officers of child welfare behavior to really come as an active member with creative ideas when we need alternate strategies. So I hope that gives you a taste of how we are starting to look at this from Placer's vantage point. We're going to take some questions at the end, but we're going to get into the next one. And this one, I am going to ask Dre to just share what comes up for us in this regard. And Dre, what are your thoughts?
In this area, we've been working for about 2 years on RapStat, and that has allowed us to get surveys out, practice getting surveys out to our team members and the parents and even the youth now, to get feedback from them. And so one of the big pieces that we've worked on, so it's a great tool for streamlining measurement of fidelity and then just really getting that feedback from everyone. And so we're using that every quarter, we're reporting out, we're using that tool to find out where we're at. How many surveys did we get back? You know, when we have a goal for, 80% return rate from care coordinators, team members, and then a 20% return rate from caregivers, for example. So we're thinking, well, we might not get as many from caregivers, and we're hitting those marks. We're doing really well. We've got one area where we're going to work on it a little better. We're trying to build up our youth survey responses now, and then we're reporting out our outcomes. So we actually have a quarterly way that we're reporting wraparound discharges and the success rate of those. And then how's our actual fidelity based on that feedback. And then, but now we're working on a process for taking this internally and talking about providing that feedback loop, creating that way to provide supportive feedback based on the information we're receiving so that we can continue to build. And then we also have analysts performing the DARTs, those document assessment and review tool. Yes. We have 2 analysts working on those now. And then we have 1 analyst that's doing the team observation measure. So that's another fidelity measurement tool. And so, we're gearing up. We're gearing up, and we're really learning how to get this information in, standardize the way that we do that. And it's been a lot of work. Like I said, it's been 2 years, and we're finally really feeling comfortable with the process. So the sooner the better to get rolling on some of those things. And we're figuring it out. Again, just that supportive feedback loop will be a big piece, just to have that communication in ways that we improve. What else should I cover, Gavin?
Well, just that we're lockstep with our provider, with our private contract provider that does RAP. They're lockstep with us in doing the RAP stat. And so that connection is huge. We're going to be citing that, that's a part of supporting RAP in Placer County, is to all be doing the fidelity monitoring together through RAP stat. So yeah, no, it's great. Cool. And let's see. So you'll notice, I could have pulled a fiscal standard, the flex fund, or, some other slides. Those are their own monsters, those are their own opportunity areas that we're going to be venturing into. This one is this is kind of my jam, and so I'm going to be sharing about it. And this is what I love most about being in an integrated system, is being able to all be on the same team. We foster a practice here in Placer where probation officer, facilitator, family advocate, family support counselor or family specialist, our youth peer support, our child welfare partners, our community partners, our foster youth service staff, all of them literally the ground is level. We all are on this field together. There is no hierarchy. There is no, I have this is my role, this is my authority. And the great thing about it is that all of the leadership is poised the same way. So there's very little turf wars here. So that's a place where you can really get into the work. So when we think about engaging all team members, we think about leveraging those relationships and that reality that we live in here where that exists. So as a county, the way we can help wraparound flourish for a provider is we can say, hey, we are bringing integrated, peer-to-peer, colleague-to-colleague approach to teaming, and they're going to show up. We have the ability to speak directly with the probation unit to say, we need officers at family team meetings. Families have questions. They need some specific stuff that only the officer can answer. And it's awesome because if the officer is pulled away on something, one of their leaders is able to come pinch in, or one of their colleagues, another officer, is able to be there. And it just adds that competency to the actual family team meeting, getting to do what needs to be done. You just even think natural supports inventory has to, how's the county supposed to help with that? Well, officers and social workers have an amazing, what is it called? Case mining, or, going through the case file to look for natural supports and connectivity and stuff like that. So there are ways that we as counties can really help that to be at the next level. So the last thing I have at the bottom is, what we can also do as counties is we can celebrate success, we can celebrate wins. So find ways to put that into your work plan, into the standards speak to it. We ask our facilitators and other RAP team members to be trained in how to do that, to make sure we're always talking about what's working and strengths, and using strengths to inform our interventions. Are we doing that as a county, as a host? So yes, we want to do that. So we're going to find a way to look at our private organizational provider to say, you're winning it here. Yes. So anyway, that concludes this dip into what Placer's doing, how we're approaching this. There are something like 80 plus individual standards. So, but we did this in not too, it didn't take too long to start brainstorming this stuff and start applying it down. So I want to stop for a moment, and we're going to share a little bit of our work plan. Dre's just going to share really quick just what comes up for us as far as our work plan. Dre, what would you like to share?
Yes, and we have the program managers following along with all of us, and she says absolutely we can share this work plan. So we will do that. So
Great.
and this is a living document, so it's already been added to since this version from July 31st. There we go. So I've added links from yesterday's webinar to our work plan, things like that. But the idea is, so the first part of the work plan was just to state our goals, what's our purpose, and in this case, we have a work plan for our RAPSAT and our outcomes measures, and it will literally say what our targets are, what fidelity targets, or what we would like to do for our return rates and things like that. In this case, for this work plan, it's dates, it's timelines, because we're very timeline driven here to get this done by 11 months from now. So this is and then we always have our sponsors, so that if anyone's referring to something, they know who to go back to for the big decisions. So the next slide goes a little bit further into it. This is an Excel spreadsheet. I used to work in big project plans, and I have found out that work plans work so much better. They're just very tangible. So just to clarify something, and I saw some questions about this, but we sat down, I kind of threw something out and said, hey, Gavin, what do you think about this as a timeline, and how do we do this? And then Gavin provided a lot of feedback. So it was very interactive to build, how will we do this? What timeframes make the most sense? And one of the things that Gavin and Leslie and Gina really figured out was that they were going to go through that manual that Gavin was talking about before, and really update the manual according to the standards, right? And then the manual is our proof of the documentation. Mm-hmm. So when we submit to the portal, ideally, we're going to submit and say, see page XYZ of the manual. And that's our current kind of strategy that we'd like to use. So just to, hopefully that answered one of the questions that came up. But and then we broke it down. We said, okay, well, let's put some realistic timeframes around these standards. And we looked at some of the standards were longer, and so we built a little bit more time in there. And then we also talked about, all right, well, once you've gone through and just kind of reviewed these standards against the manual and figured out some of the areas that need to be updated, what are also some of the policies and procedures that we really need to update? And we know those have a long lead time. So we tried to really build that in earlier in the process as well, so that we have time to, parallel to updating that manual, get our policies and procedures rolling. And but we definitely want that manual to really drive our response to the state. And then they're just, how do we route it for approval? How do we get as Richard was suggesting, how do you get your ILT involved? And in ours, it's our smart board. So, we're making sure that we're working with everyone who needs to be involved to understand what we're working on, how we're updating it, what our timelines are, what the expectations are, and how we're going to measure outcomes. So that's just a sample of how this would work.
Great. Thank you so much for everyone just bringing your listening ear and your thoughts. So I will stop sharing and let's check in and kind of calibrate here. So
Absolutely. Gavin, Dre, thank you so very much. Richard, thank you. I know Manuel is here with us as well. I do want to go through a couple of the questions that went through the chat that I can go ahead and answer quick like a bunny. In that resource document that our team has been dropping, the high fidelity approval and certification resources doc, you will find not only your wraparound county consultant list, but emails for CDSS, DHCS, the Resource Center, AAP. You will find all of the links that will take you to our webpage to find all of the resources for technical assistance, the wraparound webinars, also our TA drop-in sessions. It will also give you access to the portal. We are saying 1 portal submission per county, 1 portal submission per provider. So I apologize if that got a little convoluted when I first wrote it in, but 1 county submission, 1 submission per provider. And it has a bunch of wonderful FAQs on that main page in the portal. And also, what does supporting documentation examples look like? So if there's a question to a submission, I highly suggest going into the portal and kind of futzing around and see what's in there and see what you can grab, see what kind of resources and perfect little nuggets that we've given you. We do also have our second TA drop-in session this Friday from 2 to 3:30. After you've gone into that portal and you still have questions, please come and join us. As Gavin said, we want this to be a collaborative space. We are here for you and we want to answer all of the questions that you have so you can be successful. Also, there is PDF versions of the requirements for both provider and counties. We have dropped those links in the chat for you. They're also in our wraparound standards toolkit. So those are in there as well. And there were some questions around training. Yes, we have a wraparound foundational training scheduled throughout the rest of the year for providers and county staff to go through training. We also have a T4T foundational. So if you would like your county or organization to train the standardized training that has been put out by the Resource Center and the California Department of Social Services, that didn't want to come out of my mouth, that is available to you. The requirement is you must take foundational wraparound training in its entirety first. That is the only class we go back and check attendance in. We make sure that you've attended that entire training, and then you have the ability to go into the T4T foundational training class. Once you've completed both those requirements, you will have access to and get a certificate that you are a certified trainer for wraparound foundational, and that can be part of your attestation for your training requirement for county approval or provider certification. We do know that those classes are filling up. Please go ahead and register. Even if you are on the wait list, keep yourself on the wait list. More often than not, those classes do open and we will invite you in. So don't you worry. We are trying to accommodate for all of the training resources that are going out and through. All of these webinars are being recorded. There was a question around the AAP workshops. I'm not quite sure. I will be doing some recon and I will get back to you about the AAP workshops that they have coming up in the next month around AAP funded wraparound. So I will look into that for you as well. There is a brochure for wraparound for youth and families. We've dropped that in the chat. It's also in our wraparound standards toolkit. And now I will go into the questions that I can no longer ask enough. So Richard, this first question is for you. And I know Dre was also wondering as well. The future funding model is not 100% clear, but it appears that will be included a bundle rate for the core wraparound services. Our current model had child welfare and BHP co-funded wraparound. Is there a bundled rate for high fidelity wraparound that would be available to all foster youth? Then what is besides flex funds? Would child welfare fund high fidelity wraparound?
We may invite Danny or others, and I don't.
As I was reading it, I was like, wait, hold on, I'm inviting the wrong person. And I do have an answer that I'm putting in the chat for you as well.
Yeah, so when it comes to the child welfare component of funding high fidelity wraparound, so first off, there's all of the behavioral health dollars through Medi-Cal. We know that is also changing, and there's a concept paper out right now. So recognize that that concept paper is currently open for comment. It is a concept paper. It is not a final version of what you will see. The second piece is the child welfare components. I should also say, I think it was embedded in that question that is for all beneficiaries who are eligible for wraparound, not just the foster care population. For our child welfare population and for those families that are being served by child welfare system, we do have obviously child welfare dollars at the table. For this specific letter, we have an aftercare allocation. County child welfare and probation departments receive an annual allocation specifically to fund the child welfare portion of aftercare services. We can send you that allocation letter. We'll put it in the link, make sure that everyone has access so you know how much money you have available to your county child welfare. The county child welfare dollars can fund activities that include some of the following. So CWS, CMS, case management entry into our data system, or eventually that would be the CARES system in a few years. That would include CQI efforts, case management, direct services, including family finding, permanency planning, concrete supports, housing assistance, transportation, food assistance, and general supports to caregivers and natural supports, peer and family partners, family finding, building natural supports through the community and helping families build those connections with their natural supports, connecting to other community-based organizations who might become part of the network for that family, referrals to other services. And then I would also jump over and see if anyone wants to chime in and does anyone else have any other examples? But those are all specifically listed as inclusions in our aftercare allocation for the child welfare portion. And I think some of them can also be quite timely. So it's important to really think about and remember those child welfare dollars being available for that really like deep engagement, deep family work, the family finding, the connections to relatives, natural supports, and that time intensive work that really needs to happen in order to build that family's network. And I can put the CFLs in there and let anyone else jump in if you want to add to that.
That'd be great. And then Danny, I don't know if you can see on our Q&A as well that there was some follow-up additional funding questions. That aftercare allocations have been mentioned as a source of funding for high fidelity wraparound for the non-federal share of Medi-Cal. It says it specifies that wraparound aftercare funds allocated child welfare and probation as part of California's implementation of FFPSA requirements must be kept separate from funding for Medi-Cal early periodic screening, diagnosis, and treatment program services. The CFL lists a variety of activities that the allocations can be used for, including services that may be billable to Medi-Cal or proposed components of the high fidelity Medi-Cal bundle. Does CDSS intend to update this guidance so that we can collectively maximize federal funding for designated aftercare activities?
We have not discussed that at this point in time. That CFL would still stand as the way to do this. And what we would be talking about is really braiding funding. So how to allocate the aftercare or child welfare dollars and the medical dollars to the services to the family. We don't have a position on changing the non-federal match components.
Excellent. Thank you for that, Danny. Timothy, please come on in.
Donna, can I just offer really quick while Tim's teeing
of
up?
course.
This might be a good
Yes.
place to just remind everybody that we talk about concepts and practices of blending and braiding and maximizing federal, state, and local revenues. These decisions have to be worked out locally because the state does not know how your county uses specific allocations. And we have to caution ourselves that sometimes moving a dollar within a confluence of complexity changes ratios and changes the way you can leverage state and federal monies. It's very complicated work. So while we talk about conceptualizations here, the utility of that has to be worked out locally so that you make sure you're not creating a bigger problem for either yourself or a sister department in your system.
That's a great point, Richard.
Thanks, Danny. I still feel like there's something going unanswered because you mentioned the aftercare, fully aware of that. But really, my question is, if the high fidelity wraparound bundled rate covers the core elements of high fidelity wraparound, then what aspects of service are being paid for by child welfare for any beneficiary, whether they're in aftercare or not in aftercare, right? Because if they're in aftercare and they've got Medi-Cal, then they qualify for this service potentially, right? So if they qualify, they receive it. It's funded through the Medi-Cal bundled rate. What's the additional thing that is required for high fidelity wraparound outside of the bundled rate that child welfare would be funding?
So it was all of those things that I listed as examples, right?
So those things that you listed, like engagement, that's not part of wraparound. Community development, that's not part of wraparound. I'm sorry, I think you went through things that make a lot of sense for wraparound, but I didn't hear a lot of stuff that was like, oh, that's a separate thing. That's definitely not wraparound. It felt like you were talking about wraparound.
Yes.
And so if Medi-Cal is going to give us a bundled rate to cover the requirements of high fidelity wraparound, what else would we need?
Tim, I think while others are thinking about this, I think that's a really fair question. And it's one of the great opportunities of the moment, right? Like if we finally have a bundled Medicaid rate to fund the majority of the wraparound services, then that's the dynamic question, which is what else do we need? And I think as this, I can't speak for the state obviously here in this, but if I were in county land, I would be thinking about how the flex funds that make high fidelity, one of the elements of high fidelity is a wide and deep access to flex funds, right? Like how do I find the sources of other revenue that will augment that core rate? And again, that's a local decision that you're going to have to work out with your fiscal people. But I think there are a few areas where social service revenues will be able to augment that Medicaid rate. I'm not sure we could advocate for what they are today.
The flex funds.
Yeah,
really
I also want to tag in Daniel real quick. Sorry, Timothy.
Okay.
Daniel, I believe, is on and can help chime in as well.
Yes, and sorry, I'm on my cell phone right now, so I can't come on camera. I think to that point, the DHCS or the Medi-Cal bundled rate for high fidelity wraparound, obviously that hasn't gone live yet. And the question about how child welfare funding will blend or will braid and with the bundled rate, what it will cover, what the bundled rate will cover, what it won't cover, what the child welfare dollars will cover, whether that's through the immediate needs program or the aftercare allocation. All of that is still being determined because the policies regarding those things, regarding the Medi-Cal bundled rate haven't been released yet. So the questions you asked him, we are having those conversations actively within stakeholder work groups, getting feedback about that, and also just within ongoing planning and development conversations between the two departments. So more to come in regards to being able to answer that question about how child welfare dollars interplay with the Medi-Cal bundled high fidelity wraparound rate.
Thanks.
Daniel, surprise guest this afternoon. So happy that you're here joining us. And Richard, this was the question I was looking for you. Can the ILT team serve as the community leadership team? And then a follow-up question to this, please, is if you don't know who is on your ILT team or how to identify your ILT team, how do you find out who those community partners are and agencies are in your area? How do you get in touch with the team?
So I got two questions that are somewhat related. I think the first one, and Danny and others can help with this, but my sense is that the ILT would not be able to serve as your wraparound community team. If you look at the high fidelity standards for who is expected to serve in a community leadership team for wraparound, that the population, the composition of that team by design and intent goes way beyond department heads. And department heads are likely in the vast majority of counties, unless you're super tiny, the department heads are going to tell you, I'm not going to one more meeting where we talk about our kids together. We do that in multiple places, right? So you're all going to figure that out. And so I think the answer to the question is, can the ILT serve as the community leadership team? That would be a no in almost all cases for those two reasons, if not others. Danny, any other thoughts about that, or Manuel, or?
These teams used to exist, and some counties have sustained these wraparound leadership teams. It used to be, you had to have it. I know, like in San Joaquin County, you had a meeting called SMART. Different counties had different meetings where they would review referrals and make decisions about wraparound. So if you still have those meetings, I would think leverage that. If not, then dust them off and bring them back, because that's what we need to do. And some of those members are members of an ILT team, so there might be some duplicancy in there.
Yeah, there could be some crossover, which would be rich, but in most cases that won't be the case, which is why part of my recommendation was, on a semi-annual basis, that community wraparound leadership team should be reporting to the ILT. You can have a conversation about how is our wrap service going. I think the second part of that question, Donna, if I'm understanding it right, is how do I identify who my ILT people are? Yeah, so I guess if you're in a public agency, you've got a senior staff member somewhere, a deputy or a director or an agency head, or superintendent, a chief, who is a signatory to your MOU, and I would ask them. I would run it up the chain and say, hey, who sits on our ILT and is that functioning, and how can I get an audience there? Now, if you're in a community-based organization, if you're part of a provider network, you're quite a bit more distant from that public ILT system of care team, if you will. It's a little more difficult to answer because it'll vary in every county, but I guess you could reach out. Maybe you could send an email to Danny, could we use the RAP inbox to ask if somebody wants to know who their ILT rep is? I'm happy to have those filtered my direction, and I can help people get connected to their ILT representative if that's helpful.
Yeah, that's just fine. Thank you, Richard. I appreciate you offering that.
Sure. So send an email to the RAP inbox at CDSS asking how do I get in touch with my ILT in my county? Please name your county so we know who you are in that email, and then we'll try to get to you as quickly as we can to get you connected to your ILT people.
I love that. And another suggestion is too, if you haven't reached out to your wraparound consultant in CDSS, that would be a great way to, one, introduce yourself to Danny and her team as their individual consultant, and then ask who's on my ILT team. How do I connect with Richard Connect and find out where to go and who to gain an audience with? So thank you, Richard, for that. I appreciate it. We had another question. Does UC Davis offer an ICWA training that would meet the standard in the high fidelity wraparound standards? Thank you for that question. We're actually reviewing for that right now. We have our recommendations from the tribal wraparound work group that we had, and it's going to the TAC, the Tribal Advisory Committee meeting here soon, and we will have more coming down on the requirements for ICWA training for wraparound teams and programs. So thank you for that question. Let's see. We can answer that question. There's a PDF here, recordings. Homeless families need wraparound services. How do we get people to sit at the table? This was for Stanislaus County, and I don't know if you found a connection in the chat. Is there anyone in Stanislaus County participating in this webinar that is a provider for wraparound in the portal in this account? So connect with each other. Stanislaus, we did catch your question. We're trying to connect here for you. So your county and provider are trying to connect. Will tribes have access to the portal for our children and families? The answer is yes, tribes have the ability to certify high fidelity wraparound programs, and we encourage counties to partner with their local tribes in their communities. Also, high fidelity wraparound teams should always engage tribes when serving a tribal youth and family. We did drop the brochure that explains wraparound for youth and families. We did have a specific question, Dre and Gavin, around your work plan. To share that, I know that there is a portion of your work plan embedded in the PowerPoint that we dropped for our participants today. Do you mind if they have access to the entire work plan? What would you like that to look like?
I think it's fine to share that Excel spreadsheet if that's helpful to people. A couple of links might not work, like to the analyst folder.
Right.
It'll be a great visual for those wanting. Give me one moment and I will drop the Excel spreadsheet in the chat for you as well. Let's see. We have a lot of aftercare allocation questions coming in the pipe, and I'm assuming, Danny, that those questions are kind of good. The answer is going to be the same. Am I correct in that?
To which questions?
This one on our Word doc is question number 15. Do you have access to it?
Yeah, I have it open behind my.
Yeah, thank you. Instead of me
a
reading
lot
it.
of inputs coming at us.
I know.
And this is related to Medi-Cal match, which is funded by half state general fund and half county funds. And we are not seeking to change that at this point in time.
Okay. Question, will the county be part of attesting compliance of standards for high fidelity for the individual agencies within their county? Oh, you're on mute.
The answer is no. The county will not be involved in the applications for providers. The reviews will be done by Department of Social Services and UC Davis Resource Center for Family Focused Practice. There is a provision for if you get declined and you would like to challenge that, then it would be reviewed by staff at Department of Social Services who were not involved in any initial reviews. So that is the point. There is no counties that will be involved except for potentially through the TA process when it's necessary or helpful for the county and the provider to work together on TA. That would be available, but certainly not always required.
Yeah, but kind of like I shared yesterday, I don't suggest a provider submit something without talking to their county about what they're submitting. This partnership, right? And so if I'm a provider, I'm going to reach out to my county stakeholder, say, hey, I'm submitting this. I just want to make sure it's aligned with how you're thinking about it. Because we want to be aligned here. So I get it. They're not part of the application, but they should be partnership and aligned to what they're submitting. So I recommend providers don't submit anything without talking to your county.
Yeah, and I've said this before, and I'll just say it again to repeat for the providers that are interested in applying this portal, and the certification process is currently required for the use of aftercare within 12 months, but it is open to anybody in the wraparound community who would like to get certified for high fidelity wraparound. So there are some opportunities to put not applicable, like for example, AAP services might be funded in different ways and certain things don't apply. But for the most part, we do intend this to be open and available for anybody who would like to get certified, whether you have existing county contracts or not. If you are simply seeking to develop a program and demonstrate that you are building a high quality program and intending to deliver a high quality service, we welcome them to apply for certification.
Excellent. Awesome. I am trying to go through the chat. Team, if I missed anything on our Q&A documentation, I did also put in the chat, we do have our second technical assistance drop-in session this Friday from 2 to 3:30. So please join our team at the Resource Center for Family Focused Practice and the Family Center Practice Unit from the California Department of Social Services. We will be there to answer all of your questions. Taylor just put one in the chat. Will a list of certified providers in each county be uploaded on the CDSS website for the public to see? There is a list of wraparound county coordinators, but it's a bit outdated.
So yes, we will be posting a list that will obviously have to be updated pretty frequently. And as you can see, no matter how hard we try to keep things updated, staff change quickly. So we will take a look at our county coordinators list and try to get that updated. If you know something that's incorrect, please message us and we will get that edited and changed on our website. And then again, we will develop a process. Nobody has submitted yet. We do not have anyone who's certified, but as that really starts to roll in and we have certifications, that will be an ongoing list available on the website. We have also toyed around with the idea of making some sort of logo that folks can use on your website or marketing materials to demonstrate that you are a California CDSS certified high quality wraparound provider.
Excellent. Lizzie, please come in.
Yeah, really quick, just to follow up on that, I have two things. There's another question that came in from Elizabeth Rhodes about how will we list if the county is the provider? I don't know if there's any been thinking around that, but I wanted to lift that up before we shift gears into another question.
And the question was, how will we list if someone is a certified provider?
How will we list if the county is the provider on that list of approved or certified providers?
So yes, what Danny was just speaking to, their county provider list will be updated as providers and counties are certified and approved. Also, the Resource Center for Family Focused Practice will have a list of providers and counties that are approved. So we know that some providers who do not have direct contracts with counties right now, but also going for certification, we will add their provider on our list on our website. So there'll be a couple of lists rolling around between CDSS and the RCFFP. We did just post our evaluation for this webinar. Please take a few minutes to please fill it out. We do take all of your feedback. We take it all into consideration. We want this space to be beneficial and informative to you and to the best of our ability. So please fill that out. I want to give a huge thank you to Gavin, Dre, Richard, Emmanuel. Your perspective, expertise, and knowledge is always so valuable in these spaces. And thank you so much for taking your time out of your day and being in this space with us. We absolutely appreciate it.